Once the clinician has determined the necessary correction, check to make sure you have the proper tools for fitting the Exos free motion ankle brace. You'll need the Exos oven with extension rings, a stopwatch, scissors, a brannock and long arm shoehorn are optional. A kit with 1 sock, 5 relief pads, and plantar surface padding is included with every brace. If using a brannock, while the patient is standing, measure their foot for proper size. The key is to ensure the footplate of the Exos free motion ankle will hit just below the metatarsal heads. Place the free motion brace in the Exos oven with footplate up. Make sure the top of the oven head does not come in contact with the brace footplate. Use the oven extension rings as needed for larger sizes. A thermal wrap is included with the extension ring kit, which may be wrapped around the 2 extension rings to ensure uniform heating of the brace. The Exos free motion ankle takes 21 minutes to fit, so we use the rules of 7. 7 minutes to heat, 7 minutes to form, 7 minutes to full weight bearing. Set your stopwatch for 21 minutes. Keep it in the ready position. Now we're ready to start the timers. Set the oven temperature to high for 7 minutes. Start your stopwatch. While the patient is seated on the exam table or chair, evaluate ankle and foot to identify bony prominences that may require relief pads. Now, place the sock on the patient's foot. Apply the ankle relief to apexes of the medial and lateral malleoli and other bony prominences to ensure proper fit of the brace during molding. The standard locations for relief pads include medial malleoli, lateral malleoli, base of the 5th metatarsal, navicular, and Achilles tendon insertion. Determine how many pads are needed and what bony prominences to cover for an ideal fit. For bony prominences other than the malleoli, you may trim the relief pad to the desired shape and size. There are 2 options for fitting the patient: prone or seated. The prone position is preferred for fitting the Exos free motion ankle. Once the brace has been in the Exos oven for 6 minutes, ask the patient to lie on their stomach. Regardless of the type of correction needed for the patient, forming the brace on the patient when prone allows for gravity-induced molding, true subtalar neutral open chain positioning, and neutralizes patient muscle involvement. The Exos free motion brace cools quickly, so fitting and forming of the brace should be completed within the first 3 to 4 minutes after removing from the Exos oven. With 14 minutes remaining on your timer, remove the brace from the oven. Pull up on the boa reel, loosen the lace, and release the boa clips. Remove the tongue from the brace. Slide the brace onto the patient. Align the ankle joints with the malleoli apexes. Apply the tongue section of the brace, tucking the lateral and medial edges inside the tibial cuff. Ensure the spine of the tongue is vertical with the Achilles for even overlap. Fasten the boa clips. Push down to engage the boa reel and turn clockwise to tighten the laces enough to remove any excess lace for a secure fit. Over-tightening the cable during fitting leaves depressions in the plastic and prevents proper joint alignment and molding. Using one of the elastic wrap, securely wrap above the ankle, then under the arch and around the forefoot. Use the second elastic wrap to wrap the tibial cuff. Make sure the entire brace is covered with the elastic wraps. If the patient has a flexible deformity, increase the medial longitudinal arch with your palm while squeezing the hind foot with your fingers. Increase the varus or valgus forces as desired or appropriate for your patient, or simply replicate the shape of the foot to prevent the progression of the deformity. The brace should be hard enough to remove and maintain its shape after 5 minutes. Once you're confident the brace is rigid enough, remove the ace wraps and slide the brace off the patient. Allow the brace to sit for an additional 7 minutes before weight bearing. During this time, add the plantar surface padding and fit to the patient's shoe. Instruct the patient on donning, doffing, skin care, and brace care. The brace should always be worn with a tennis shoe or street shoe with a deep footbed. After 21 minutes, the patient may step into the brace you've placed in the shoe and fully weight bear. If the brace was heated in the Exos oven longer than 7 minutes, you will need to add additional time prior to weight bearing. Allow the patient to ambulate in their new Exos free motion ankle brace. After the initial fitting, some patients may require slight adjustments to their Exos free motion ankle brace, especially if they feel areas that may cause rubbing or discomfort. This is typically around the malleoli or other bony prominences. Because the Exos free motion ankle brace is reformable and customizable, these adjustments can be made quickly by a clinician. Using a heat gun, spot heat the area where you'd like to make the adjustment. Only heat the specific area, not the entire brace. Once the material is malleable enough, reform the Exos material using your hands to provide the relief needed. Place the brace back into the shoe and ask the patient to reapply and verify the adjustment has relieved any pressure points. The Exos free motion ankle brace is the first off-the-shelf functional brace that can be formed and custom fit to a patient within 30 minutes, providing a customized, flexible ankle orthosis with a total contact fit. Comfort, flexibility, support. The Exos free motion ankle.